Have you ever wondered why you sometimes wake up with an erection? Or why your partner does? Well, I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to explore the reasons behind what's called nocturnal penile tumescence. If you're new here, I share videos about urologic health, bladder health, sexual wellness, and much more. If you find this helpful, be sure to subscribe and share this channel with your friends. Morning wood, or waking up with an erection, is actually a normal part of what we call nocturnal penile tumescence. During the night, everyone goes through about 4 to 5 phases known as REM sleep. In this unique stage of sleep, people often experience dreams, and along with that, men can have penile erections and women can have clitoral engorgement. Interestingly, the idea of nighttime erections dates all the way back to the time of Plato, around 327 BC. He described it by saying that in males, the genital organs behave in a way that seems independent and driven, almost like a force that doesn't listen to reason and is guided by strong desire. Quite a vivid description. Moving forward in history to around the 17th century, nighttime erections actually became part of legal matters. At that time, infertility, or the inability to have children, was considered a sin and could be grounds for divorce. Erectile dysfunction was linked to infertility, so men were required to prove that they did not have this condition. To do this, they underwent examinations of the genitalia conducted by theologians, physicians, and even judges. In some cases, members of a jury would sit by the bedside while a man slept to observe whether he experienced nighttime erections. It sounds unbelievable, but it's true. It went even further, with juries requiring proof of proper function, including natural movement and firmness of the penis. In extreme cases, couples were even observed during intercourse. Thankfully, these practices were finally abandoned around the year 1677. That really is unbelievable. After that, things became quite confusing, as people began to think that erections and nighttime emissions, or wet dreams, were essentially the same. So, between the 17th and 19th centuries, these were referred to as pollutions, and there was a widespread belief that masturbation could cause a variety of illnesses and medical problems. They even came up with strange devices, like rings for the penis fitted with sharp spikes. Honestly, that sounds incredibly painful. There was also something like a corset designed for the penis that extended from the shoulders all the way down to the knees. It wasn't until the 1920s that a follower of Freud, Wilhelm Steckel, stated that erections during sleep were completely normal and occurred in people of all ages, from infancy through older adulthood. He also explained that morning erections, which are typically the final erection during sleep, are entirely normal and actually indicate good health. After that, researchers began seriously studying sleep-related erections. They used devices somewhat similar to what we have today to measure how firm and rigid the penis becomes during the night, often using rings placed around it. They didn't stop there. They also conducted studies on women. Researchers used tools to measure clitoral temperature, along with a soft balloon connected to a pressure system to evaluate clitoral engorgement. They also used various instruments to assess vaginal blood flow. What they discovered was that women do experience increased vaginal blood flow, as expected during arousal. However, the pattern differed from men, as women more commonly experience these changes during non-REM sleep rather than REM sleep. All of this research ultimately led to one key conclusion. These nighttime erections are actually a sign of healthy blood flow to the penis and overall good erectile function. In fact, sleep-related erections may even help protect erectile health. The reason is that during an erection, oxygen levels increase in the tissues. So having erections during sleep helps improve blood circulation in that area and supports normal erectile function when it's needed. But why exactly do these erections happen? There are 4 main reasons. The first involves the nervous system. At night, the part of your nervous system that becomes most active is called the parasympathetic nervous system. This is the system responsible for rest and digestion. During REM sleep, it helps the body relax, allowing muscles to loosen and blood to flow more easily, which can lead to erections. It also slows your heart rate. The second reason has to do with hormonal changes. At night, levels of norepinephrine, which are usually higher during fight or flight situations controlled by the sympathetic nervous system, begin to decrease. As morning approaches, testosterone levels rise. Together, these changes create conditions in the body that make erections more likely. The third reason is physical stimulation. If you're lying on your stomach or if your bed sheets rub against the penis, that friction can sometimes trigger an erection. Lastly, in the morning, your bladder is often quite full. This can put pressure on certain nerves known as the sacral nerves. When these nerves are compressed, they may trigger a reflex erection. This also helps explain why you may wake up with an erection and why it often goes away after you urinate. However, it's not entirely dependent on bladder emptying. When researchers have studied how often men experience erections during sleep, they found that it typically happens about 3 to 6 times per night. At least one of these episodes usually reaches more than 60% firmness and can last up to 10 minutes. Again, this is completely normal and actually a sign of good health. I also get asked quite often, how can I stop morning erections? The truth is, you really can't, and you shouldn't try to, because they're a sign of a healthy body with normal erectile function. Some people may notice that they experience these nighttime erections less frequently. This is especially common as men get older, since erections may become less frequent or less firm with age. In addition, people who have sleep disorders or disrupted sleep patterns may also have more difficulty experiencing these sleep-related erections. So, having your sleep properly evaluated is closely connected to your erectile health. If you're experiencing trouble with sleep, it's important to discuss that with your doctor as well. Finally, these nighttime erections actually play a role in maintaining the length of the penis. If you stop having erections during sleep, the penile muscles may begin to contract over time, which can lead to a reduction in length. Since most people wake up at the end of a REM sleep cycle, experiencing them is a good sign. There's no need to worry. Just be a little careful when you go to the bathroom in the morning so you don't accidentally bump yourself. If you don't have a morning erection occasionally, it's usually not a concern. However, if several months pass and you're no longer experiencing normal morning erections, it's a good idea to consult your primary care doctor. Problems with erections can sometimes act as an early warning sign, like a canary in a coal mine, indicating there could be an underlying issue with your heart. That's why it's important to get checked and make sure you don't have conditions like heart disease, high cholesterol, high blood pressure, or diabetes, all of which can reduce blood flow to the penis and potentially lead to more serious issues over time. I hope you found this video helpful. As always, remember to take good care of yourself, because you truly deserve it.